Welcome back to our channel. So today we're going to discuss the things related to medical technology and being a medical technology student. As a 21st century learner, our subjects are not only limited to the traditional subjects but also encompasses subjects such as data science, which is beneficial to us as a digital natives and is something we'll be needing in the future as professionals. So for today's video, we will be applying what we learned in class, which is to make different types of graphs from a certain data set. We will be sharing the 5 graphs that we made using the software called RapidMiner. The data we used for these graphs is from a data set about dengue and includes information such as hematocrit, WBC, and platelet levels, as well as symptoms such as fever, body weakness, nausea, and many more. For our first graph, we correlated white blood cell values in relation with pneumonia. Pneumonia is a serious illness which is an infection of the lungs that affects people of any age, but most especially young children or infants and old people. This can be measured by complete blood cell count or CBC, and an increase in white blood cell count WBC is an indication of bacterial infection or pneumonia. The graph shown above correlates the level of WBC to the chances of having pneumonia. It shows that as the levels of WBC goes up, the probability of having pneumonia is also getting higher starting from the 4 mark. For our second chart, we correlated the loss of appetite with hematocrit levels and its relation with diagnosis admission. According to Oje et al., thrombocytopenia or a low platelet count is common in patients that have dengue virus infections. Platelets or thrombocytes are blood cells that aid in blood clotting. They help stop bleeding by clumping together when an injury involves the blood vessel. Based on the chart, it can be deciphered that patients with dengue virus have a low platelet count which leads to loss of appetite. It can also be seen that patients who experience loss of appetite have a lower platelet count compared to those who did not. Looking at the diagnosis admission, the patients who experience a loss of appetite and have the highest average platelet count are those patients who are initially diagnosed with acute viral illness, while patients who have other diagnoses have the lowest average platelet count. It can also be seen that patients who have a severe dengue and loss of appetite have a low average platelet count of 61.7:1. Patients who did not experience a loss of appetite have a higher average platelet count over. This proves that the loss of appetite is directly proportional with average platelet count and the severity of dengue.